Well, each year, more than 70 million post-surgical patients receive opioids, and research shows that 1 in 15 will go on to long-term use of these medications, putting them at risk for abuse or addiction. And while these meds can be an important part of treatment, patients and caregivers should also be aware of alternatives. So joining us today with more, we have orthopedic surgeon Dr. Scott Sigmund. So, doctor, thanks for being with us today.
Oh, thanks for the opportunity.
So let's first talk about the problem of opioid use. Why do you think it has become such a growing issue here in the U.S.?
So as an orthopedic surgeon, I routinely operate on patients, and as we're all aware, surgery is usually a very painful process, and as doctors, we try to get you through that experience, really minimizing your pain. The gold standard has always been the use of opioids. The problem with opioids is that 1 out of 15 people that are exposed to opioids can go on to long-term use. And that is really one of the ways in which we're actually fueling this opioid crisis that has developed across our country. So we're really trying to look for alternative methods of treatment for pain management.
So when it comes to options, do people have other options right off the bat than opioids? What kind of alternatives are we looking at?
Yeah, there certainly are. I use in my clinical practice a medication called Exparel. So, for example, if you go to the dentist will numb up your mouth and do the surgical procedure, and usually you get pain relief for a couple hours. Well, we can do the same thing for surgery at other body parts as well. And Exparel is basically a long-acting form of numbing medication, and in my patients, they can get relief upwards of even 2 to 3 days. So, for example, if I do a knee replacement on a patient, I fully expect that patient to be walking down the hallway, really complaining of minimal pain the day of their surgery. It's really remarkable how well these patients can do, and it's truly changed the way I clinically practice.
So not many patients probably know of all the alternatives, maybe not as well versed in that area. So should they be the ones bringing it up to their doctors, or should they be able to count on the doctors to kind of say, hey, listen, we've got some options for you?
Yeah, that's a great question, and I think our take-home message here today is that we really want to empower our patients. You guys have a choice. Every patient has a choice as to what their treatments are, and I strongly recommend that you ask your doctor what available alternative medications are there outside of opioids. And it can be stressful going to a doctor. Many times patients aren't comfortable asking questions, but there's a terrific website, patientdiscussionguide.com, that can provide you those questions. You can print it right off and you can bring it to the doctor's office. So really the message here is that we want to develop a plan that's right for you. We want to try and get you through your surgical intervention without you becoming the 1 in 15 persons that goes on to this horrible substance abuse problem. So reach out to your doctor, ask the questions, be involved in your care.
Doctor, have you heard good results from patients that you've thus far used these alternatives, that you've gone through and said, hey, we're going to do something different this time? Have they said their pain is minimal?
Yeah, so I've been using this medication for about 2 years at this point, and it's really remarkable how well the patients are doing. I use this medication now on every possible surgical patient that I can. I have a conversation with every patient prior to surgery about what my expectations are for their postoperative pain management. I then ask the patient what their expectations are. We come together and we formulate a plan. The overwhelming majority of my patients are off all narcotic medication within 72 hours of their surgery.
All right, wonderful to hear. So where can we send our viewers to get some more information?
So patientdiscussionguide.com, again, is that website that will allow you to get the questions that you need. Again, that's patientdiscussionguide.com. We strongly recommend that you check that out.
All right, Dr. Sigmund, I want to thank you for being with us.
I appreciate the opportunity.